All right, guys, thank you so much for coming out today. This is the second part of the APhA pathway series, and we're going to talk about public health and regulatory. And we have really great 6 panels that we have. I'd like to introduce them, and actually I'll share the slides and then they can go through their own introduction. We'll start with, all right, can you guys all see my slide? Okay, good. All right, let's start with Richard Lee from P2.
All right. Hi, everyone. As you can see, my name is Richard. I'm a P2. And I think I want to introduce myself by starting off with my goals. I have a bachelor's degree in public health science from the University of Maryland. So I think I have like an inherent interest in impacting health on like the population level rather than the individual level. And I think the reason for that is like, I think that the US kind of has developed a treatment first type of mentality when approaching healthcare. And I think it's really backwards. And I don't think enough attention is focused on prevention of these treatable conditions that require individualized care. So I want to go into using the knowledge gained from my bachelor degree and like this current PharmD curriculum to impact health on a population level. I don't really have like a specific position or a specific setting or company or regulatory agency that I want to work in. I just want to be able to say that I work with population health. On the way, I hope to get accepted into the regulatory science PharmD dual degree, which I submitted the application a few weeks ago. So if we could like throw some positive energy in the airwaves, I'd appreciate it. At some point, I do also hope to earn an MPH, but that's not an immediate goal of mine. That's just something I hope to cross off my list at some point in my life. To set up for a career post-graduation, I kind of like have tailored my pharmacy school experience to be really narrowed down to a road that's very niche to pharmacy, to public health, I mean. As you can see, I am the Smith-Lip Pres-elect. Small plug for elections coming up. Quick nudge nudge, so if you're interested, feel free to apply. I just recently placed first in the regulatory science competition alongside Delaney, who's right after me, so you'll also be able to hear from her. I'm part of the DART team, which stands for like the Data to Action Research team that was developed by Dr. Shaya, which is like evidence-based research focused on the relationship between social determinants of health and health disparities. Amy is also on the team too, and she's a featured panelist, so you'll hear from her. I am also an FDA Pathways intern at the Center for Tobacco Products. So I just reviewed applications for new tobacco products to be approved. I mean, available on the market. They don't like us when we say approved because it like implies that it's safe to be used, but it's not. Anyway, so I do that at the FDA. And in undergrad, I honed in and developed some epidemiology skills when I was the assistant at the Center for the Substance Abuse Research at the University of Maryland. There I looked at emerging drug abuse trends, both on like the local and community level, and then also on the national level. So that like being my first experience doing public health work like holds a special place in my heart. So even though it's not pharmacy school related, I feel like I had to throw that in there. So that's my experiences. Some tips I have for people that are interested in public health is I feel like it's really important to learn specific buzzwords and phrases that only people in our field would know. And what I mean by that is like public health is a really niche field. So only people that work here will know these phrases and terms. It's not like common knowledge. And a way to show that you belong and have an understanding of the subject that you're applying for is to know these words and be able to use it in a sentence in describing yourself. So like look for words and phrases in internships, job postings, and like don't be afraid to like fall in the rabbit hole of new words and being able to use that in your interview and selling yourself. And my second tip is to find someone early along in your pharmacy school career that has the same similar career goals as you, who is like a year or two older than you. And then you can use their experiences and follow in their footsteps. That person for me is Hannah, who's also on this panel. Who you'll hear her introduce herself in a few slides. And like she's literally like my roadmap. Call her my roadmap. like regarding pharmacy school experiences. And just having that person that, you can seek advice from is super helpful. Like picking and choosing what their accomplishments are and tailoring it to your eventual list of accomplishments is something that I encourage everyone to like have in their back pocket. So yeah, networking, know who's interested in the same thing as you. And yeah, I guess that's it for me.
Thank you so much, Richard. I feel like the tip about the buzzword really, I could resonate it because I think people really look at your resumes and see like the buzzwords and see like if you have the experiences. So I thought that was really good. And the next up is Delaney McGirt from P2.
Man, I don't want to go after Richard. He's a very like inspiring public health person. But as you mentioned, yeah, I also did the regulatory science competition with him. Richard's great. You're going to get into the program, Richard. But yeah, so I'm a P2. My name is Delaney, for anyone who doesn't know me. I'm getting more interested in regulatory science, which is part of why I did the competition in December. But a lot of my interest in public health kind of comes from the angle of policy because I think we fundamentally run healthcare wrong in our country, and I want to do something to change that. And so kind of you can see there, one of my ultimate goals in pharmacy is to end up working in healthcare policy. But before I get there, it's important for me to like practice clinically and actually see patients and get experience, because I believe that's some of what's wrong with healthcare policy in our country. Like we have politicians that don't have experience, and they're the ones, writing policy. So that's kind of what I ultimately want to do. You can see some of my experience there. I worked at the NIH before coming to pharmacy school, so have some experience in like interesting clinical populations, because the clinical center at NIH only sees patients that come in on a research protocol. So we treated a lot of people that didn't have health insurance, a lot of indigent populations, and we were able to get them in on research protocols and treat them in our cardiac lab, which was a really great experience. And got to see a lot of health disparities through that. And kind of the biggest thing I do at University of Maryland related to public health is I'm a graduate student research assistant with the Patients Program, which is in the PHSR department. And it's an amazing program. It's run by Dr. Mullins, who is a really inspiring person, but he's essentially created this entire program dedicated to the field of P4, which is patient-centered outcomes research, for anyone not familiar. And his kind of ultimate goal is to make research patient-centered. So we have this big problem in research where we do what we call helicopter research, where we come in, we use a population as our research subjects, and then we leave. And we don't disseminate the research. We don't really involve patients in the design of the research protocols. And in a way, it's like, how are they benefiting from that? And especially here in Baltimore, we have a long history of taking advantage of people of color here in research protocols. And so his aim is to fix that. And so we partner with a lot of community organizations and churches, a lot of faith-based places in Baltimore, and get people involved in research. So we help clinical trials around the Maryland area. We actually create clinical trial like planning committees, and we get patients on those committees, and they're actually there from the ground up, saying like, here's how I think you should design the protocol, and giving their feedback the whole way. And then we make sure that when those studies are done, we actually disseminate the information, so it goes back to the community. And that's been a really inspiring thing to be a part of. And so I won't go through all of my positions, but yeah, that's kind of where some of my inspiration comes from, and hope to one day do something in policy and help to fix some of those things. You can see some of my advice there, mainly just like get involved, find what you're interested in, and don't be afraid to reach out to professors and reach out to people who are doing things that you think are cool. That's how I've gotten really anything I've done, like jobs before school, jobs in pharmacy school, just not being afraid to reach out to people. And you don't have to have experience in what you're interested in. You just have to show that you're passionate about it, and that's going to be inspiring to them. And yeah, don't be afraid to reach out and go for what you're interested in.
Thank you, Delaney. Delaney has been such a good advocate for pharmacy, like going to legislative day and also organizing the legislative. I cannot wait for the next year when she is also more involved with PLS. So everyone should come out and definitely ask her questions, because she's been involved with so many things. Her interest in pharmacy is like everywhere. So I'll definitely have her as a mentor. Thank you so much.
Thanks, Sean.
All right, next one is Meg from P3.
Great. Thank you, Sean. Hi, everyone. My name is Meg Delawit, and I'm a third-year pharmacy student. And great presentations from Richard and Delaney, very inspiring. You guys did a lot more P2 year than I ever did. Amazing. So my interest primarily is like population health. That is the essence of public health, where you're focused on more of a, instead of just, clinical individual care, you're thinking about big picture, what are the impacts on a greater scale. So my interest specifically is like care transition organization, thinking about value-based healthcare in this country. Our healthcare system is designed in a way that the healthcare system profits from people getting sick versus people's well-being. So thinking about how do we transform the system that we have, even in the world of pharmacy where it's just fee for service, to be more paying for better outcomes for patients. And so like value-based healthcare is area of interest, and finding ways to use medication like quality measures to assess benefits. I'm currently at the PAVE Center here at the University of Maryland alongside Sean, and I think I saw Karen on the call too. And that center, it's similar to the patients program that Delaney mentioned, in which we've primarily focused on assessing what is important to patients when they get treatment. So we do a lot of interviews with test subjects to assess, like when you are like dealing with depression, what is important to you? What are some trade-offs that you have? And so the goal is to put research out there so that policymakers, payers understand when they're making decisions for patients. I also work with Dr. Villalonga Olives. I think she lectures like one class during 1 year, but she does great work about assessing social capital, and that means how strong communities are and how that builds resilience in times of adverse events like a pandemic, like a tsunami. And so that's kind of different because I have a background in sociology, and so understanding how communities interact it's an interest in terms of also public health, how that translates over to health. Other than that, I guess tips that I would have is that in this atmosphere currently, because we're not able to network face-to-face, the biggest advice would be to create LinkedIn or even Twitter as your professional base to network with other mentors. There's great posts about upcoming like internships, job posts that you might be interested in. Even I know some of our professors have LinkedIn's, I follow them. They give some great tips about some of like their clinical work or advice to incoming pharmacists. And so definitely create one that becomes your professional footprint online. And other than that, I think, especially in public health, you have to, when you're looking for careers and internships, look beyond the pharmacy role. Like in the description, if it says, like these are the skills we're looking for, assess what you know about yourself and your skills versus just saying, oh, like it doesn't say pharmacy, so I can apply here. So a lot of it is fitting your own personal experiences. So broaden your horizon in terms of your career outlooks later on. That's all I have.
Thank you, Meg. I really admire by Meg, especially with the patient-centered perspective. I think we tend to forget that a lot as we go up to like upper class and like busy with like rotations and stuff. But she's always passionate about for the patients, and learned a lot from you for doing the research together. So everyone recommended for PAVE Center. All right, next one is Hannah from P3.
Hi everyone, my name is Hannah, and I guess just to start, I did come with a public health science bachelor degree from undergrad, and I knew the reason why I chose to get a bachelor in public health science was that I really, really valued how the classes I was able to take focused, like how everyone mentioned on here, like the population level. And I got to spend time learning like epidemiology, environmental health. It was just like very diverse aspects of health, not just focusing on patients, but like the surrounding environments. And I think ever since getting my background on public health science, that I think I found myself naturally gearing towards public health as I entered pharmacy school. So I found myself getting involved in like the student section of Maryland Public Health Association. And right now I am the president. And I think like this whole time, I really, if you can tell on my slide, I feel like my experience is just like scattered everywhere. It's not really like finding an exact pathway. But I think one of the big things I want to point out is that I think it's really important and valuable to just gain experience anywhere that you might have a slight interest in. And I think that's like how you get to know yourself better, because you get to figure out what you do like, what you have values for, what you appreciate, and what you find passionate for. So that's how I kind of got myself to learn more about myself, especially this past year. So I think one of the most highlights for me was participating in the America's Got Regulatory Science Talent competition last year, where my team was really luckily able to win. But I think that exposure, I really enjoyed the whole competition in terms of finding a means that we can find a solution in terms of shortcomings in like the regulatory aspect. I apologize, I think I have like notification sounds. But anyways, like I think that really exposed myself to like the regulatory aspect. And I know Karen is on this call. She started like this little Asian farmer group on Facebook. But through that, I got like access to, it was like a webinar series last fall. So just by attending that, I know I was like, I just spent like an hour on a Tuesday night, and I realized that what I want to do is, my career goal is like gaining a regular affairs fellowship, because I really, just like how my background is kind of scattered everywhere, I really, really valued how regulatory affairs, like you're kind of knowing about everything that's going on a broad level, regarding like a medication, like you're knowing is the big idea of what's going on in the clinical trials in terms of safety, and you get to communicate that with the FDA. And I really appreciated that. Like, although I've had like prior FDA experience, I like the industry aspect in terms of you get to be innovative and creative, and you still get to communicate in terms of the FDA, and bringing out a safe and effective and valuable drug. So I just wanted to point out like some major tips. Just really, really push on networking, regardless, like if that means professors, peers, even people at work. I think like a small surprise was like, I worked for CVS. I was talking to a patient, and then just the topic of him used to be working at Pfizer popped up, and I was like, oh, you know, that would be like a dream job. And on the spot, he was like, you know what? Let me just connect you with my sister, and we're gonna do the best to get you a good word for like an internship. And like that just came out of nowhere. It's just like, I think it's really important to be caring and affectionate to just anyone you meet on the spot, whether it's at work or school, at home. Again, I already touched on get to know yourself better, just figuring out what you do and you don't like. And another important thing is like, I think it's really important to not compare yourself. Like, I know I've had people around me be like, oh, especially as a P3 going up towards P4 year with all our rotations. I had peers around me saying like, you know, this person had like this many APhAs or industry APhAs, or like this many internships. And like, I feel like when you're trying to compare yourself, you might feel into like self-doubt. But I think it's like really important that you have differences that make you stand out. And everyone has something else to bring to the table. So just like being confident and just figuring out your own experiences and knowing how to like sell yourself, as well as just figuring out what you find passionate in.
Thank you, Hannah. All those tips are really important. I think public health, definitely you have to know a lot of like different views and see it as a holistic view for everything, what you learned. I believe networking is super important. And also like we happen to compare because you know, there are a lot of peers around, and like we have different experiences, but I definitely believe it brings different values for everyone. So thank you so much. All right, next one is Grace Victor from P4.
Hey guys, so I'm Grace, I'm a P4, and when you look at my slide, you'll probably notice that I don't have a lot of experience in public health, and that's because I kind of entered late in the game. So I think public health has always been kind of in the back of my mind because my parents are from India, and I've experienced or seen the clear, like, I guess, gap in education compared to here in America, where we educate patients on things like diabetes and things like that. And I have an aunt who recently passed. She had been on dialysis for about like 10 years and been in and out of the hospital. And she was my mom's age, and my mom's one of the healthiest people I know. So that really struck me and was something that I've always kind of wanted to work toward. But I didn't really know. I thought that the ideal first step would be like become a pharmacist in a hospital or in retail and then do that on the side. So I didn't really know how to make it into a career until I kind of talked to more people, which is good. That obviously one of our tips is like networking, so getting to know. And I actually went to some round tables in my third year, so that kind of got me more exposure as well. But I do think so for like under my professional activities, I'm not going to list them out for you, but a lot of them have to do with leadership, which I think is really important, especially for us in public health, to just be open to one, receiving feedback and interpreting it, and then to be able to lead initiatives and kind of lead that change, because I think that's a big part of public health. So for me, I'm actually interested in Indian Health Services. So they have a separate residency application, so I've been applying for that. And so I'm trying to work with specific populations. There's so many different opportunities. So not only Indian Health Services, but things like the Federal Bureau of Prisons, like the Navy has pharmacists, the Coast Guard has pharmacists. So it's a very broad kind of field in pharmacy that I'm still learning a lot about. So I'm glad that you guys are here and learning about this, in such, as P1s and P2s and P3s. But really, I think for my tips, it's just one, look for those leadership opportunities. Attend some roundtables, just trying to get to know more about, like Hannah said, like your passions, get to know yourself and what interests you. Definitely talk to advisors and faculty and even alumni. I talked to someone in my fraternity, and they led me to someone else who was an alumni, and it took me 5 or 6 people to actually, before I talked to like an actual resident at IHS, but like I got something out of each of those interactions. So really grasp all that you can from each of those experiences. And then, like we said, just network. And so for my goals is really just to, get my degree, get out of here, get a job. And then eventually I do want to work on a global scale to promote kind of health education for patient populations that don't have the same education that we have. Yeah.
Thank you so much, Grace. As Richard mentioned, public health and regulatory is very specific niche. So I think we know of a lot of like PGY1 residency for like clinical or fellowship, but like we don't know so much about like what's out there for public health related or regulatory related fellowship. So I would like to listen to that during the FNQ. So thank you so much for coming. All right, and next, last but not the least, Amy Bao from People.
Hi everyone, I'm Amy. Man, like listening to all the presentations from the P2s and P3s really makes me feel kind of underqualified to be here. Like Grace, I'm also kind of late to the game, so I don't have that much experience in like reg affairs. I was on the SMIDFA board for 3 years. I'll talk about that a little bit more, but I'm on this panel because I was fortunate enough to get a fellowship in medication safety. It's like a 3-part fellowship with Novartis, the FDA, Purdue. So I'll be with each of those partners for a little bit of time for the fellowship. And I guess to kind of go through how I got here, going into school, I didn't really have a path in mind. I didn't know what I wanted to do after graduation. So, like I joined a lot of orgs P1 year. I tried to expand my horizons to like get a feel of what I liked. I did know that I wanted to involve myself in public health because, like everyone else has said, I get a lot of fulfillment from knowing that I'm affecting as many people as possible on a global scale. But also from undergrad, I was in the pre-pharmacy society at College Park, and we had a bunch of speakers come in, and most of them were somehow involved in like a public health field or an industry field. So a lot of them had really good things to say about their careers, and they encouraged most of us to, like consider pursuing a career in that field. So that's why I joined SMIDFA P1 year, and I was on the e-board for 3 years as co-historian, treasurer, and vice president. And then I also had some experience with like internships at the NIH, FDA. And then I applied to APhA rotations with the FDA and CDC and luckily got those as well. I'm currently on my CDC rotation right now, actually. But yeah, so also I only listed my experiences that I thought were related to public health, but in school I was also involved in my fraternity a lot, and then also PLS and ROCI, and I had a job at Hopkins as well. So like in school, for the most part, I was kind of leaning towards doing a residency because as like most of you guys probably know that our school kind of pushes students to do residencies. So I was kind of like, well, like it seems like most people are doing that, so I should probably do that too. But then after doing my APPEs, I realized that hospital pharmacy wasn't really for me. So I was kind of starting to freak out, like at the beginning of P4 year because I was like, oh man, like I probably don't want to do residencies anymore. Like I have no idea what I should do anymore. So I attended like a bunch of the AMCP and IPHO panels that they held about fellowships. I went to like the job fair to talk to a lot of recruiters. And I was fortunate enough to find when I was like Googling job opportunities and various fellowships, this fellowship that I got, I found that it was really interesting and it like specifically appealed to some personal interests that I had because it's in medication safety, but the block with Novartis is specifically in name creation and regulatory affairs. So basically it's like coming up with brand names for medications, which is like really niche. But in undergrad, I actually really had a strong interest in linguistics because I took some electives in my senior year and I really liked it. And I think like if I had a dream job, it might have something to do with like linguistics or learning languages, something like that. So, I thought that this was a really unique experience where I'd be able to do work in pharmacy, but also in like a field that I'm passionate about outside of pharmacy as well. And I think I was able to get the position even without a lot of industry experience because during my interviews, I really showed that I was passionate. And like for this position, there are 2 positions that are like kind of the same, but the other one is with a different drug company instead of Novartis, and it's not in name creation. And when you submit your application, you can choose to use the same application to apply to both programs or just a single one. And I think most applicants decided to, like, it makes sense to apply to both because, it increases your chances, but I only applied to the Novartis one because I really wanted to do something that I was interested in, and if I didn't get it, then I didn't get it, and I'll probably try to pursue something else. So I think that really showed that I sincerely liked the work that I would potentially be doing, and that resonated with the interviewers. So yeah, just to I guess go over some advice. Again, so pursue something you actually like doing. I know I've talked to a lot of, not to like knock residency or anything, but like a lot of people from our school do end up doing residencies, but I've talked to a lot of them currently doing residency, and some of them do sound like they're pretty burnt out. You know, like they're just doing it to try to get it over with so that they have it on the resume and they can get a good job. You know, that's something that I couldn't see myself going through. And then also make sure to keep track of all your accomplishments, like even small things. Like throughout school, I had a Word document that it wasn't even organized that well, but whenever like I accomplished something in my student orgs or just anything, I would write it down and like try to be as thorough as you can, like describe it in detail, like say what happened, because it really helps out when you're working on your resume P4 year and also for interviews for whatever you end up pursuing, because, you know, like everyone advocates for using the STAR method, you know, like giving a story about what happened, like how you dealt with it. And going back to this document will really help you then. And then lastly, don't be afraid to ask for help. Since I was pretty late to the game in applying for fellowships, I actually asked for my letters of recommendation like 1 week before the deadline was due, but like all the people that I reached out to for help were super understanding. Like they ended up writing like really good letters of recommendation that I was like really grateful for. So, you know, yeah.
Thank you, Amy. I think it's really fantastic that you can always find something that you can do with the PharmD degree, like if you look for it. And also, please make easier names for the drugs. It's very hard to memorize.
We'll try.
Yeah, all right, so now we're going to do the Q&A for the panels that what we received, but I will unshare the slide so we can see everyone's face together, but we'll try to answer from like P2 to P4 if we can. If not, also we'll just skip the few questions with the respecting the time. All right. So the first question was, what is a regulatory job? For Richard, what do you think? What is the regulatory job?
I think regulatory, I don't know what regulatory is like from like an industry pharmaceutical side, but from like a regulatory agency type of perspective, it's just like applying and enforcing the rules and regulations that will like kind of keep drug developers in check, you know, to ensure that the products are safe for public consumption. That's like my definition of it from the like an FDA perspective. Delaney could probably speak more on like the policy perspective, but that's all that I'm able to provide for this question. Sorry.
Oh, okay, Delaney, do you have something to add?
No, I would let like Hannah or someone more experienced in regulatory answer that.
It's so hard to define it as a 1 or 2 sentence, but I just wanted to hear people's opinion for this, because for some people, regulatory may be a little bit abstract, you know, to approach. So Hannah, do you have something to add?
I'm not sure if I'm like qualified to answer this question, but from what I could understand is like I've never had direct experience through the industry aspect for regulatory, like at the FDA. It seemed like, let's say, like a regulatory project manager, they're kind of really initiating the conversation with the sponsor, which is the industry company trying to pass the drug. And you have to pay a lot of attention to detail and times because you're setting up very numerous meetings to talk about like the different aspects of the drug application and the status. But I feel like in terms of industry, like it's kind of the same thing. Like you really pay attention to the regulations and like what standards you have to meet to. So I think that's why like I find passion in it, because I'm taking pharmacy law right now. I don't know if a lot of people enjoyed it, but I actually really enjoyed studying for it because I thought it was like kind of industry. Like you really have to pay attention to the smallest details and like the wording. Yeah.
Okay, does anyone want to add? I wanted to ask Amy, but sorry to put you in the position.
No, that's okay. I mean, to put it in simple terms, like it's either working for like a federal agency like the FDA or CDC, and then on the industry side, it's like doing some type of work where you have to, you know, work with these federal agencies. So it's just like two sides of the same coin, basically. and then like most of the work involves like working with laws, regulations, or population-based data so that you can, look at clinical trials and make decisions based off of those.
Okay. Meg, I have a question for you. What type of jobs are available regarding public health? It could be retail, it could be, any kind of like residency. What do you think is available after graduation?
Yeah, so I think traditionally when public health comes up in pharmacy, it's usually thought of like the Indian Health Service. Like any, if you work for a government agency, they're looking at like a large scale population data. So like CDC, FDA, those agencies are public health. So public health is very broad and it's just any jobs that involve like analyzing large data and synthesizing it to like policy and any type of regulation. So yeah, I think traditionally it's like the Indian Health Service and government agencies.
Grace, do you have something to add? Like I asked earlier, like how would it be, what would be the best way to like think about the residencies and like look for those?
So there are a lot of different residencies based on what you're interested in. So for me, I did Indian Health Services, which is basically focused in ambulatory care. And it's basically just going on these Native American reservations or Alaskan Native reservations. And they get all of their care on the reservation. So they have the doctors with them. You have collaborative practice agreements. So you're helping doctors out. You can kind of prescribe your own things with their permission. So it's a lot of collaboration interprofessionally, and it's a lot like ambulatory care, counseling them on diabetes. Some things that are more specific to Native American populations with like opioid and naloxone co-prescribing, and like Hep C is prevalent in those populations. So focusing more on those things. And then just to answer the general question, I think there's a lot. So like for residencies, I know some of the public health residencies are not, they're more like institution specific. So they might not be on forecast, but there's a lot of global health kind of residencies that might be like PGY1, PGY2 combos. So you kind of have to go out of your way to look for those. And then I know for me, someone asked me why I was applying to IHS residency when I could just get a job with IHS. And I think that's a really good point. Like Amy said, like residencies are not necessary for everyone. So I still plan on applying. Like if I don't get into the residency, it's not the end all be all, right? So like I still plan on applying to, IHS or Federal Bureau of Prisons, or hey, I could be on a Navy ship. Like, like this is the opportunity to do all those things and learn about those things. So really take your time to research what's out there, because it's such a big field. There's so many opportunities that people like don't know about. So definitely do your research.
Thank you, Grace. I guess next question will be for Richard. What do you think about the regulatory science dual degree? Do you recommend it, or how to get in?
So the thing is, with the regulatory dual degree, I actually had a lot of people tell me that they were considering it and then they decided not to do it. And the reason why I decided to pursue it was just because of how much of a good deal it is. Because for those that don't know, the fees to be part of the regulatory degree like curriculum is inside your PharmD curriculum fees. So as you're paying for your PharmD, you're also paying for your regulatory science degree. The only costs that is extra are the classes that you take during that one summer semester. So like, I think if you weren't a PharmD student and you're only taking the regulatory science degree, it would be like upwards to $30K, I think. But because your PharmD covers your regulatory science degree, then you're only paying for that one summer. It's only like $5,000. to pay for the whole regulatory degree. So to me, just like cost benefit, I feel like it was it just made more sense, especially if I know that I want to go into regulatory, like the side of it. I think it just made sense for me to pursue it. What else? And it wasn't that much more work from what I asked the older people above me. And the classes that you take during the first year of your regulatory science program is included as electives for your P3 year. So if anything, the only extra work that you really have to do in terms of like the workload is just having to balance rotations along with course load in your P4 year. But like I said, just looking at the pros and cons, it made much more sense for me. And the reason why I chose the regulatory science degree, dual degree over the NPH dual degree with like the Masters of Public Health is just because I know that the Masters of Public Health, you would graduate a year later. And I don't know, for me, it was just important because of my current financial situation and what I need to do to like get out and find a job as soon as possible. But you know, that may not be the situation for you. And if you want to talk further on like what the difference is between the two, we can go into further discussion. Just reach out to me, and I'll try to give you what I know. But I'm not a master in any of it. But I can give you my opinions and what I think and my understanding of what I think they both degrees offer.
Thank you so much. Yeah, I'll make sure to share your LinkedIn information if you guys are all open to that, to everyone. And also the next question will be, if you go back to P1, is there anything that you want to do it differently? Start with Delaney, please.
What was the question? If I could go back to P1 year, what would I change?
Yeah, like, so basically if you start again, the pharmacy school, which we don't want to imagine, but if you can.
Well, I mean, that wasn't that long ago, I guess, but what I change? Maybe be a little more organized. I took on like a lot of things pretty fast, and I'm glad I did because I'm like passionate about everything I'm doing, but it got really busy really fast. So maybe being a bit more organized going into things.
Okay. How about you, Meg?
I could go back. I would say I would start with the end in mind. And I know like when we're going through pharmacy school, we're all like trying to figure out what we're trying to do.
Mm-hmm.
But I think I would create an Excel and go on LinkedIn or like go online and see all the jobs that I'm interested in, or like, you know, elicit some form of like excitement when I see the description of, you know, what the job entails, and then write down like what kind of skills do those jobs require, and then use my pharmacy years to kind of acquire those skills that they ask for. So by the time I'm a P4 or ready to apply, I kind of acquire some of those skills and I'll be ready to apply. So I would say like just go through and make an Excel, look at the jobs that you see are out there, and then formulate a plan throughout your pharmacy school how you acquire those skills, even if it involves like taking classes outside of pharmacy school.
Right, I think that's a really good point. Yeah, I should start that. Okay. All right, Hannah, would you do something differently if you go back to P1? Would you try internship or any research, something differently?
I think I wish I started research earlier because I'm doing research with Dr. Mattingly, Joy Mattingly, and I really wish I started that earlier because like we have such great faculty in our school, and Dr. Mattingly is like awesome. Like actually, he just sat down the first time and he was like, "What do you want? Do you want a fellowship? Do you want a publication? Like I just want to do what you want to do." And like I have like a whole research group, so we were really honest. We're just like we all want a fellowship, we all want a publication, and like I think like the only reason I wish I could go back earlier is just the research takes such a long time. So like even though we reached out to him last March, I think like as of now we're finally getting something to like making a draft and trying to get it published. So I wish I had like the opportunity to like maybe reach out, maybe possibly to another professor and start on other projects earlier.
That makes sense, yeah. How about you, Grace? If you go back to P1, 3 years ago.
I know it seems like forever. I think honestly for me, it would just be being more open. I think when I came into pharmacy school, I had a very defined picture of what I wanted to do when I left. And I was like, I want to be working as an ambulatory care pharmacist at an AC clinic, in at the hospital I work at now, which is very different from what I actually ended up wanting to do. And I think I kind of let go of some networking opportunities and some opportunities to just learn more about other fields because I was like, I already know what I want to do, right? And so I think for me, it was just trying to be more open and learn more about, like Anna said again, about myself and utilizing those advisors and just, even if you don't know what you're interested in pharmacy, just saying like having a conversation about like, okay, like this is what inspired me to do pharmacy. I don't really know what that's related to. Like, what do you think? So.
Yeah, this is very inspiring just to listening to you guys. That's why like I think it's one of the perk of doing this series. So Amy?
I guess for me, even though I didn't really take a standard path towards pursuing a fellowship, I wouldn't actually change much about what I did since P1 year because I think because I was always unsure about my path, like it forced me to expand my experiences and really figure out what I liked and didn't like. And like not only that, but it kind of strengthened my resolve to actually do what I like because, I realized that I didn't want to have to settle for a path that I wasn't really passionate about. And then, like still feel that feeling of uncertainty. So like now that I like discovered this fellowship and I got it, like I feel pretty happy and like I'm no longer like worried about, like actually liking my job.
So jealous. One day I'll get there. All right, guys. With the respect of time, I'm gonna ask the last question. Just with your own year. So for Richard and Delaney, it will be P2, and Hannah and Meg will be P3. So what do you think your highlight of the year? Like, if you can pick one event from the school related, like regulatory competition or like research or like internship APhA, just one or two sentences. Start with Richard.
I guess for me, the reg science competition is actually like really important to me. I had a list of things I wanted to accomplish when I came into pharmacy school, just because like I knew what the people above me were doing, like following them on social media, look what they did, like that type of thing. And winning the reg science competition was actually on my list. So being able to accomplish that was actually a perfect highlight for me.
Thank you. Delaney?
Yeah, honestly, I would agree. That was a really good experience, both in regulatory science and also in teamwork. It was great working with Richard, and we had several other team members, one of whom was living in India, and like we worked really well together as a team, and scheduling like times and meetings, and everyone really like put in a lot of effort into it. And we had like lots of long meetings with like some industry professionals who we like pitched our idea to, and essentially got just shot down, and they were like, nope, that doesn't work actually. And so it was a really good experience, like perseverance, and then working with our team. We put a lot of effort into our idea, and we were really excited about our idea, I think, in the end. And so it was like really great to feel that kind of all pay off in the end.
So for the regulatory science, you can also team up with PhD students or like other outside of school too, right? Okay, thank you. Okay, Meg?
I would say being part of the vaccination clinic and vaccinating people at CMC is the highlight of this year, because it just means that we're getting closer to managing the pandemic.
Right, thank you so much for doing it. Hannah?
I think me too, like the COVID vaccine clinics I was able to do through CVS, and then just like overall pharmacy school, it's not really related to public health or regulatory. I was just going in San Diego with like the AMCP team. I'm just like really bonding with everyone in pharmacy school.
Thank you. Grace?
I think just going from working with patients on a case at school from that to actually working with real patients and being able to like talk to them and even do medrecs, just like seeing how excited they are to be able to talk to you was really inspiring and made it, you know, I was like, I suffered for 3 years, but it's worth it.
All right, last but not least, Amy.
Well, I guess probably the highlight is getting that phone call from my fellowship program. But out of my rotations, I really liked working at the Poison Center. I thought it was like super interesting. So P3s, if I don't know if your rotation rankings are due or not, but I think it's a really good elective, or it's not an elective, it's Grace, do you remember what it's called? Like the one that's
Patient care.
yeah, the
It's
patient care
required
one.
that you-
I recommend that because I learned a lot, and I think some of the stuff is actually tested on NAPLEX, and it's stuff you don't really learn in school. So it was really interesting, and my current rotation at CDC is also pretty cool.
Thank you. Those are very practical advices. So that's it for today. Thank you everyone for coming out and listen to the panels. And next month we'll come back with the clinical track one. So please be there for it. And we're gonna just take a picture real quick for the annual report. So if you guys don't mind, please turn on your camera if you can. And if not, you're also free to leave. Thank you. Let me just stop the video. Not my video, I'm saying record.